Good morning, beautiful. Good morning.
Good morning.
Okay, so we're doing rhinoplasty today. And tell us what are some of the things that bothers you with your nose?
Yeah, so there's a couple of things. One is breathing. I have a deviated septum. The other is as a result of soccer, I have a bump on the side of my nose here. And then the last is the kind of the hump. And then when I smile, it droops.
It droops.
So
Okay.
it's those things.
Those things. Okay.
Yeah.
So breathing is more difficult on right or left?
On the right side, I believe.
Okay.
Yeah.
And that's right where you are pointing. There is significant bony projection at the cartilage bone junction, and it just has a little bit over projection, as you mentioned. And when you smile, it droops and has a little bit of a hump that we're going to remove. The beautiful eyes, beautiful facial features, and nice proportions. So it's going to be really nice.
Thank
We're going to
you.
improve your breathing. Okay.
Sounds good.
Awesome. Looking forward to it.
Thank you.
My pleasure. So I'm excited for our beautiful patient. Had a significant hump, significant deviation from, she's a soccer player and she had multiple fractures and caused a C-shaped deviation here. She had overprojection and she was bothered by this significant deviation. And as you can see the axis deviation, she also had a lot of breathing difficulties. So we corrected that with septal rhinoplasty. We removed the hump, we lowered it in a conservative manner, in a preservation technique, lowered the bony deviations, and gave her a much better profile. And her breathing is going to be better because the nasal valve is more open, and the segment of the upper septal deviation we also corrected. We narrowed the bone, and overall she's going to have a smaller, cuter, and nicer nose. We're excited. I have our beautiful patient Sarah is here. She is gorgeous and she had beautiful eyes, beautiful bony landmark, very beautiful facial features. But she was bothered by a significant deviation and she had a hump. And it's been how long now?
It's been only 4 weeks and it looks so much better already.
Yeah. What do you think?
I absolutely love it. I can't believe when I look at the photos how good it looks. It looks very natural. It's very straight. The deviation is fixed. Overall, you just did an incredible job.
Okay, my pleasure. And it's only a few weeks, and it's going to get better. This area was very thick and deviated. We worked a lot to make it nice dorsal aesthetic line. The tip is just because she had very super thin skin. We wanted to keep very nice contour and border and naturalness to it, and the hump is removed, and it's just going to get better as the swelling goes on. So let's just come over here, and then why don't you point out what you see here that's the biggest difference?
Yeah,
Come
so
over here.
the biggest difference is obviously the deviation from the front. It was pretty skewed to the right side, I believe that is. And then the other biggest difference would be if you were turned the other way, the hump is actually really significant from the other angle, but now there's no hump. So it's those two main things. And then also the tip is pushed up a bit more, which is like helpful for.
And we can see these bony landmarks were super sharp here and here. And we corrected it, and there was excessive cartilage that we reduced, and then really supported the tip. But because her tip was fine, we just wanted to make it look super natural, and we were able to do it. I'm excited, and it's only a few weeks. It's going to get better.
Oh, it's going to get better and better.
Okay, awesome.
Thank you so
good
much.
to see you. My
Thank
pleasure.
you.
Thank you.